Hello, welcome to the University of San Francisco School of Nursing and Health Professions virtual info session for the Doctor of Nursing Practice program. The presenters today will be Brian Budds, who's the director of the DNP Completion Program and the chair of the Healthcare Leadership and Innovation Department. We also have Julie Maxworthy, who is the director of the BSN to DNP program and the past chair of the Healthcare Leadership and Innovation Department, also known as HLID. My name is Juman Quace. I assist with the Doctor of Nursing Practice programs at USF, and I will be your moderator for today. And now I'm going to turn it over to Brian Budds, who will do the overview.
Thanks, Juman, and thanks, Julie, for being here today, too. And thank you to all of you for signing in and joining us for this few minutes where we get a chance to talk about the DNP programs available at the University of San Francisco. On the slide, you'll see here our overview of what we plan to do in our time together here. We're going to talk a little bit about the school, the university itself. We'll give an overview of the different programs available and some details about them. We'll talk about the DNP degree in general, its history and purpose, some specifics about the tracks and descriptions of what we do in these programs, and about the final project, which is essential part of all of our DNP programs here at the university. We'll talk a little bit about admission requirements, and that should leave us plenty of time to answer some questions that you might have. The webinar is being recorded, and that recording will be available in about 72 hours. If you have a question, what we ask you to do is use the control panel, which you'll find on the right of your screen. Type in the question, and Juman will be able to sort of moderate those questions for both Julie and me to answer for you as we go forward. So if we're all on the right plane, if this looks like the right destination, let's take off. Juman, can we have the next slide, please? First thing is to introduce the school. Many of you may already know the University of San Francisco. We are a moderately sized private Jesuit university in the city of San Francisco. We've got, as you can see on the slide, over 9,000 students in the school, over 100 different degree programs in these various schools here. We have a large and robust School of Nursing and Health Professions. We've also got a School of Management. We've got a School of Law, my alma mater, a School of Arts and Sciences, and a School of Education. Our School of Nursing and Health Professions, as you can see on the bottom, has over 1,100 students in the undergraduate school and over 400 in our graduate programs. Next slide, Juman, please. The School of Nursing is a School of Nursing and Health Professions. So we have a number of programs outside of just our nursing programs. As you can see here, we do have a strong Bachelor of Science in Nursing program. We've got a couple of different tracks for achieving a Master's of Science in Nursing. We have the Doctor of Nursing Practice programs, which we'll be talking about today, and there are various approaches to those. But we also have programs that are not specific to nursing, a Master's of Public Health, a PsyD degree, a Doctor of Psychology and Clinical Psychology, which is a practice-focused degree, much like the DNP is. And we have Masters in Behavioral Health, Health Informatics, and Health Care Simulation. Next slide, please. I mentioned we're a Jesuit university. We're a university with a sense of mission and vision, and that's really important. That imbues everything we do in this school. Our motto, you may have seen around town if you're in San Francisco on our logos and banners, etc., is to change the world from here. And that's a focus, I think, if you do join us, that you'll see really is part of what we do, and that it is our mission not only on the university level, but on the level of the school and each individual program to seek social justice, diversity, critical thinking, leadership, to lead the way in this area um, according to our vision as a university. Next slide, please. The school has been around in San Francisco since very shortly after the gold rush. As a matter of fact, really, it began in the middle of the gold rush when the city itself was exploding in size. So it's been over 150 years that USF has been here and been granting degrees in different areas. It also has a robust and exciting history in its School of Nursing. We'll go into the details of the history here, but there's a relationship with St. Mary's Hospital that is contiguous to our campus here that goes back quite a way. But we've been a trailblazing program as well. We were the first institution in California to offer the DNP degree. And we're also founded a CNL, or Clinical Nurse Leaders Program, in 2004 that was also groundbreaking. We are fully accredited across the board, and we're a very important school of nursing and health professions within the state of California. Next slide, please. What I'd like to do in this next series of slides is just sort of talk a little bit about the degree itself. What is the DNP, and what it might mean to you. So again, if we can go to the next slide, Juman. Why a Doctor of Nursing Practice degree? Well, first thing to emphasize, I think, is that a DNP is, in fact, a practice-focused nursing doctorate. It is not a research-focused nursing doctorate. This is something we'll talk about a little bit today, but that will also, as you pursue a DNP, you'll get to see the nuances of difference in that focus. But that is what is fundamental to the Doctor of Nursing practice. We are focused on the practice of healthcare and the delivery of healthcare and nursing. It is an advanced educational credential. This is very important, and as we'll see in a couple of subsequent slides, as the profession is evolving and growing, as healthcare is evolving and growing, this degree is sort of taking off as an advanced credential for people that want to do some level of advanced practice that requires some level of advanced knowledge, but is not fundamentally a research degree. The focus of all of what we do is, in fact, improving the quality of care, the practice of nursing, the practice of healthcare, and aiming that at providing positive outcomes. Next slide, please. I mentioned that we're looking at this degree in the context of the evolution of healthcare and the evolution of the nursing profession, and even quite apart from what we read every day in the newspaper about the Affordable Care Act and changes and this and that and the other thing, any of us who are in healthcare, and I'm presuming that's all of us on this call today, recognize that we're in a really dynamic period of evolution and of change. Whether it's all of it's evolving toward the good or not, well, that could be a good conversation in one of our classes. What we're trying to focus on with this degree and with our degree programs is to enhance your competency in providing better health care, to increase your knowledge, to enhance your knowledge, and very importantly, to enhance your leadership skills. We look at the DNP across the board, whether from our schools or others, as a thought leader in the profession. It's DNPs who are at the point of service in their profession and who are leading the profession forward as we go forward. And that's really what the goals of all our various programs are to improve competencies, enhance knowledge, and enhance leadership skills. Next slide, please. This slide lists what are called the DNP Essentials. The American Academy Association, American Academy of Colleges of Nurses, American Association, I think it is, of Colleges of Nurses, has published these essentials on which the DNP is based. And our programs adhere to this quite closely. We spend a lot of time, Julie and I and our fellow faculty, at ensuring that our classes, both our didactic or classroom classes and our practicum experiences, address these essentials that are laid out by the AACN as being essential to the DNP degree. So we spend a lot of our faculty time working on this, saying, boy, are we doing this effectively? Are we doing this well? And we continually try to update what we have in our program, what we deliver to you, to ensure that it's completely in line with the articulated DNP essentials. Next slide, please. All of this is done, too, in the context, as I said, of a changing healthcare environment, but we believe that the demand for this degree is increasing dramatically. I don't have percentage numbers to share with you right at the moment, but as healthcare becomes much more complex, as the delivery of healthcare becomes more complex and confusing in ways, as the demand for true leadership and vision increases, we believe that the demand for the DNP degree and what we help provide you with also increases. So you can really finish your program and hit the ground running in the marketplace as a leader in the profession, and one, again, who is practice focused. So we look at our PhD colleagues as our brothers and sisters in nursing who are doing very important research work. The focus of the DNP degree is to translate that existing research, the evidence that is out there, into actual practice. So it's really in the trenches, with mud on your boots, if you will, is the focus of the DNP degree. You know, Juman, you jumped ahead a slide, and that's fine. We can go there to that next slide. A little bit of details about how we deliver our program. The DNP has both full-time and part-time options, so we don't need to get into the details of this right now. If you do have questions about this, some of them we may be able to answer today, but we certainly can answer them in more detail regarding your own specifics going forward. But we do have options for you to do the program full-time and finish at a somewhat rapid pace, to do it more part-time. Our programs are designed to be friendly for someone who is a working professional. We use mostly what's called a hybrid model format. So we are not entirely in person nor entirely online. We can talk a little bit more about that in some details. The important piece is this, is that we are exploring the use of distance learning technology and methodology. We have students that commute to our program from quite a distance, and we are committed to making it a relatively easy process for you to get through this program. And in doing so, we have some face-to-face component, we have some online component, and we try to hit the sweet spot on that for our students. In general, most of our DNP programs are on a program that calls for what we call teaching weekends. It's essentially, although not exactly, it's essentially every other week or 2 weekends a month during the semester that we consider a teaching weekend. If you're in the program and you're taking classes on that schedule, you are likely to have some sort of class experience roughly every other week. That may mean a class that's in person, where you come to the university It may be one that you could attend through an online software that we use. It may also be a class experience that is more offline or done on your own time through distance learning technology. But in general, keep in mind that we have a process in our DNP programs, with the exception of the executive leadership program that we'll talk about in a moment, that's essentially an every other weekend teaching weekend commitment. In general, our fundamental courses for the DNP program occur either on Friday evening or sometime on Saturday, either a morning class or an afternoon class. Again, we've designed the program as best we can to be as accessible as possible to the working professional. If you are in some of these other programs, including the Family Nurse Practitioner track, Masters of Public Health, etc., one of the master's programs, those courses occur on other days and other times of the week. Next slide, please, Juman. What do we have for program tracks? In general, we have what we're calling the Healthcare Systems Leadership track, which focuses on leadership of delivery of healthcare to individuals and to populations. We're undergoing a bit of a change and a refocus of this program to be even more focused on population health. But generally, this program is a degree that allows a person with an RN and a bachelor's in nursing to get a doctor of nursing practice that is focused on healthcare systems leadership. We have also what we call the DNP completion, which is very much the same content, if you will, of the healthcare systems leadership. It's simply designed for people who already have a master's in nursing of some level. And again, we'll talk a little bit more of the detail there. I mentioned a little earlier that we have an executive leadership doctor of nursing practice program. This is a program that is designed for people who are already in an executive leadership role in their organization or are on a track within their healthcare organization to move into an executive leadership. This program, for example, has folks who already are a chief nursing officer, chief operational officers, something like that within their organization, or perhaps on a track where that is their goal, their employment goal is to achieve that level. That is a program that, if you're very interested in, I encourage you to ask for more information about it. It's an exciting and dynamic program that we have here for nurse executives. We also, of course, have an FNP track. So for those of you who are interested in developing an advanced practice role as a nurse practitioner, we have that is done within the context of developing also the degree of a doctor of nursing practice. And we now have also a psychiatric mental health nurse practitioner track as well. So it's possible for you to get your DNP and also become credentialed as an advanced practitioner, as an NP or a mental health nurse practitioner. Next slide. Excuse me just a moment. Basically, in our healthcare systems leadership, we have, I mentioned, our core courses or our essential courses. We focus on a number of different areas of leadership and project management, informatics, ethics and policy. We attempt a data analysis. We're trying to develop for you in the didactic courses those skills that you will need going forward to effectively translate evidence into practice and to be a thought leader in your profession. So this is the focus of the Healthcare Systems Leadership Program, as is, if you could go to the next slide too, it's essentially the same focus of the DNP completion, However, this is more designed for nurses who already come in with a master's degree in nursing that are seeking professional advancement. Next slide, please, Juman. If I can, I'll just spend a moment more on this executive leadership program. If this is something that you think you might be interested in, I really encourage you to seek more information from our recruiting folks who will point you in the right direction. This is, as I said, it's aimed for people who are already in or on a track toward being nursing executives within their organization. This is a cohort model. We tend to have people that come from all over the country, frankly, all over the world. We've had some people from countries outside of the United States participate in this program as well. They will travel for 2 intensive weekends each semester at a hotel downtown. So they come in and start on a Thursday afternoon and end on a Saturday afternoon, and it's quite an intensive experience. It's a very unique curriculum, one we're quite proud of. And again, if you are on an executive track in your organization or envision that, I'd encourage you to seek a bit more information about this. Next slide, please. I mentioned earlier that we have the tracks that allow you to become certified as an advanced practice nurse, as a nurse practitioner. This is both the FNP, Family Nurse Practitioner, or the Psych Mental Health Nurse Practitioner programs. One point about that, I of course don't know what you folks are interested in, but in general, this evolution of healthcare that we're talking about, not only related to the Affordable Care Act, but certainly as a result of that as well, are clearly increasing the roles available to nurses to deliver primary care and other services that are outside of the traditional scope of practice of nurses. And this is what I think FNPs and our psych mental health nurse practitioners do, and our programs will allow for you to develop that certification as well. Next slide, please. We've been talking about a number of our courses that are the didactic or the classroom courses, and that is a part of any program that you are involved in the DNP, for the DNP degree. We have these didactic courses. We also have a clinical or a practicum component to your degree. In this practicum component, you work on a project, which we'll talk about at the end. Or if you're on an FNP track, you're also working on your clinical skills and developing your clinical skills in a supervised setting. The degree requires, this is by accreditation agencies, it requires 1,000 hours of supervised practicum throughout the degree program. For those of you who might be coming in already with a master's in nursing, you can transfer in up to 500 of those clinical hours. We have a somewhat expansive view of what practicum hours can consist of. We encourage you to develop all kinds of professional development skills. So if you're going to conferences, for example, that are in line with what you're working on in your practicum project as a student, those hours can be credited towards your clinical hours. Any work that you are doing effectively on your project can be credited as clinical hours. In short, you work closely with an advisor, an academic advisor who is your chair of your committee, to ensure that you are getting the proper practicum hours and that you're counting them, that you're developing and evolving as a leader according to the training that you're receiving here. it is not difficult to complete these 1,000 hours in the period of the degree, especially for those of you who are bringing in some clinical or practicum hours already into the program. It does take some work, but it's quite doable. What we have listed on this slide are the approximate completion times. As I mentioned at the outset, we have both full-time and part-time students, and so none of this is etched in stone here. But roughly speaking, as you begin thinking about this career now, if you are coming in with a master's already, and you are there doing either the EL or the DNP completion, you'll probably be able to finish in about 2 years. The FNP track is a little longer because there's more clinical hours there for 3 years. And if you're starting out with the BSN and getting a master's along the way, either a clinical nurse leader master's, or we have other options now in which you might be able to get an MPH, for example, that process from BSN through completing your DNP is roughly 4 years. Next slide, please, Juman. I've mentioned the project a couple of times, and we certainly don't need to get into the details here, but one thing that I'd like to address sort of the general concept here. Every student, no matter which program you're in, does an evidence-based project. It can be a quality improvement project, it can be a change of practice or practice improvement project. It is a project that in essence takes the evidence, it takes the research that you have familiarized yourself with as a student, the most current evidence available, and translates that into a real life experience in which you are taking that evidence and applying it in a project, could be within your workplace or elsewhere, in which you take that evidence and show how it can improve patient care, improve healthcare outcomes, improve quality or delivery of care. This project you begin very early on in your work as a DNP student, regardless of what track you're involved in, by working with your academic advisor. We work with you very closely and sort of manage as you develop an idea for this, as you get permission from a place to pursue this project, as you immerse yourself in the research so that you become expert in this area, and as you develop your plans for bringing this project to fruition. And we walk very closely with you throughout, both your chair and your committee, which involves asking other faculty members to be involved in this process with you. This is, for us, it's the most exciting part, I think, of teaching. I'll let Julie comment when I finish this slide in a moment on that, but I think it's so exciting for us to see students come in, get an idea of, wow, this is how we can make this research real in the workplace, and then spend the time in their program developing an effective project, bringing it to fruition, evaluating it, and then writing it up so it can be shared with the profession and begin your careers as thought leaders in nursing. Before we get to the next slide, I think, Julie, I've been very long-winded, and I'd like to give you an opportunity to weigh in on that if you have any thoughts at this point.
I'd happy to. And I welcome everybody to our time together. Yes, it is one of the most exciting parts of this work is to see students come in with a concept and actually see it realized, taking their passion and doing a project that makes a difference for them and also for the profession. Yes, most definitely. And that's something we work very closely with you as a student in our program, is to find out what is your passion. How do you want to make a difference and also working within your scope of influence to make sure that you are successful. So no matter where you are currently, we will work with you to help give you opportunities. If you believe that you want to do a project that may set you up for a different trajectory for your career, we will work with you. We are well connected within the state and other parts of the country and also the world to help you realize that goal. If you're interested in health policy, we have connections up in Sacramento so that you can do a project that really can set you up for the next phase of your career. So, thanks, Brian.
Yeah, and just to emphasize a point that you make there, we are a faculty with a very broad and varied experience with different areas of expertise, and that faculty loves working with students. So it's that's an exciting part of what we have as a program here, is being able to put you in touch with people who can help you achieve your goal because they've got some particular expertise in that area. And it's broad, as you may have noticed. I'm not only a nurse practitioner, I'm an attorney, and I've worked with a number of students on projects that involve areas of law and regulation. So it's kind of exciting and fun. Can we go to the next slide, please, Juman, which is our last one you'll hear me droning on about here. But just a quick review of some of the admission requirements for this program. We do require, regardless of the program that you are entering, that you do have a bachelor's degree. If you have a master's degree, that would change perhaps which program you apply for. You do have to have documentation of a nursing license. We recommend a GPA of 3.0. The statement of professional goals is an extremely important part of your application and your admission process. And it's one that really you want to spend, if you're very interested in this, you want to spend some time thinking about this and explaining where you want to go and why you think USF is the right choice for you. We need a professional resume, so we can take a look at your resume or your CV and see what your past history has been and what you bring to the program and what areas we think we can help you with moving forward. And 3 letters of recommendation. And here, of course, you want to turn to people that know you professionally and can speak to your professional skills. Of course, transcripts from all of your institutions that you've attended. I don't know if there's anything more specific about admission requirements to point out there, and that actually does finish the presentation here.
Brian, can I add one little piece about this slide?
Please do. Yeah.
We take very seriously your statement of professional goals. We really look at that very closely and see where you are, see where you want to be, and see how we can help you. And if it's, it gives us a good picture of you as an individual. So I highly recommend you take time and really be intentional with that part of the application.
Indeed. Next slide, Juman, I think is our question slide. And so now, I can't tell from here, but if you've had any questions that you'd like us to address in our time remaining, the panel on the right of the screen allows you to enter a message, and then Juman, I don't know if you've gotten any here that you can moderate here.
Yeah, I have a couple so far if you want me to just read them out.
Please.
So the first question is, are we responsible for scheduling our practicum hours at healthcare facilities?
It's a very good question. And it's one that's a little hard to answer with a blanket answer, because in general for the DNP, outside of the FNP track, and we'll put that aside for a moment, but for the DNP, everybody sort of creates their own project in many ways. What you're responsible for is working closely with your advisor to identify what are clinical hours, what are practicum hours, excuse me. Many of our students will do their project within the context of their current work environment. So they may be doing a project at as a part of their current employment position that could also count as this DNP project. And then it's a matter of working with your advisor and your chair to ensure that you're properly crediting the hours that you put into that toward these practicum hours. Others may work with an agency or a setting that is not their work environment, but that they set up with someone who gives them permission to work within that setting. And similarly, that is essentially you work with that agency to determine the hours that you put into the practicum work. The NP tracks, the FNP and the Psych Mental Health NP tracks, are slightly different in that those are more clinical education hours in which you need to be working with a preceptor. And in that, the programs, and again, Julie, you may have a more up-to-date information on this than I, but the FNP programs work, or the NP programs work very closely with you to help you find a setting to do the precepted clinical hours. So you're not out there entirely on your own. You have a lot of support from the program in finding those settings.
Yes, you are correct. The NP is a little different in the sense that there's a clinical, it's absolutely clinical component, and there are individuals within the NP program that help coordinate that to ensure. But if you are interested in the DNP completion, oftentimes people do their projects within their workplace. And so in that situation, we just have to make sure there's a memorandum of understanding and work with you as far as your placement goes.
But also don't be concerned about that if you can't imagine doing a project within your current work setting. We don't require that. You know, we'll help you find a way to do a practicum project, perhaps in another setting.
Absolutely, that was my experience. I'm a graduate from the program. I was in the first cohort in 2008, and I was in a workplace setting that was not conducive for me to do my practicum hours. So I actually did it outside, and I had incredible support from the university to help me with placement, and I was successful. So yes, absolutely.
So you're not alone. No matter what track you follow, you're not alone on this. Yeah.
Absolutely.
Okay, can we have another question?
Mm-hmm.
Yeah.
What is the average time frame on application consideration?
Huh. I don't know the answer to that.
I would say it depends on how quickly you get your documents in. If you submit all your letters, you get all your letters of reference in, and you turn everything in. We, as reviewers, when we get the notification from the recruiter folks, we get into there very quickly. So we make our determination with just a couple of days once everything has been given to us, and then hopefully that turnaround is quite quickly to the potential student. So it depends. A lot of it depends on the actual potential student and getting all their information in.
Yeah, I think part of the reason I don't know that is that I usually see it when the package is all together. And as Julie said, we try, those of us that review, try to turn that around very, very quickly. The one thing that I know has held things up in the past is when we've been waiting on, say, a third letter of recommendation. Mm-hmm. So, you know, I hope that answers your question, whoever had that one.
All right, next question. How do the students out of country get clinical hours?
We have had students in the ELDNP program. I think the only country that outside of the U.S. that we've had has been Saudi Arabia. And in both of those cases that I'm aware of, they've been able to do their project within their work setting. And so that's been something they've been able to do. We had an arrangement with or a memorandum of understanding with the hospital that these people were working in. But that's much the same as students who have come from other states or even other places within California. They've been able to arrange it either within their workplace or a separate agency.
Okay, does the BSN to DNP program automatically award a master's degree, or is that optional?
Hmm. Julie, as director, do you want to take that one?
Sure, sure. It depends on what you ultimately want to come out with as far as role and degree. So because as Brian described, we have lots of different options, which can be a little dizzying, we understand. But really, if you want to go post-baccalaureate, you have the option of getting the DNP. If you want to get a FNP or another NP on your way, you can. And when you want to get an NP role, you do have an option of not acquiring a master's on the way. And in that situation, there is no master's stop, but the expectation is you go all the way through the program. And so if you aren't successful, the downside to it is you are in sort of a difficult situation because we can't grant you a master's because you've not taken the master's classes. A majority of our students do get a master's on their way. They either get a master's, an MPH, a CNL, and then they do the DNP or the NP portion. Hopefully that helps answer your question. But yes, we do have a non-master's DNP, but that is with an NP role preparation.
How does the DNP program align with a student with an MSN from a CNL program?
I'm sorry, Juman, could you repeat that, please?
Sure. How does the DNP program align with a student with an MSN from a CNL program?
Well, if someone already had an MSN from a CNL program, they would be coming in and probably doing the DNP completion. And in terms of alignment, what I would suggest was that their DNP project allows them to move, in essence, to a next level, if you will, of leadership, where CNL is aimed more at the point of care, or the micro system kind of view. I think the education that they would get and the project they would work on in the DNP would encourage them to look larger, more systems-wide, more macro in their view of impacting change and quality. But it's quite a natural fit. Many, if not, I'm guessing most of our students who have come through the program, certainly the RN to, BSN to DNP, get the CNL along the way, and it's quite a natural fit.
I can add a little bit to that as well because I see a couple other questions. We give you credit on your practicum hours from any master's in nursing program towards the 1,000 hours that you've to help get to that 1,000 hours quicker. So that's a piece of this as well that I wanted to make sure was clear. Mm-hmm. And we look at any student who comes into our program, we look to see, especially if they've taken DNP or PhD programs in other coursework, we look to see if there's any way we can give you credit for those. So there'd be less classes that you would need to take within our program. So yes, we give up to 500 hours of prior master's program practicum / clinical towards the 1,000 hours.
What is the job market for DNP? Where do you see most DNP students hired?
A good question. One, I would say that the job market is an evolving job market. We actually are doing some evaluation of that as we speak, of trying to get a better sense of where our graduates are. And they're frankly all over the map. We see them in many different roles. The EL that I've mentioned earlier is one that in some ways we don't see an enormous change in the job setting for these folks because they've come in already in a leadership EL role. Although I would say that the DNP and the experience of the students I've had has really enabled a number of people to get that next and better executive job coming out of the program. Julie, how would you answer that, do you think, for our DNP students, other than the EL, of where we are finding them employed afterwards? It's
We're seeing more and more leadership roles within institutions, definitely. If it's not required, it's recommended that they're doctorally prepared. And also in academia, we're seeing a need for more educators. And for that role, you need to have a doctorate. So those are areas that we're seeing more and more individuals leaning towards. And in the NP world, there was a recommendation for entry into practice, and that is being revisited by the different organizations. But early on, it was a recommendation that entry into practice for NPs was going to be doctoral at 2015, and that time has passed, but it's still on the radar very strongly that that's going to be entry into practice for that level of nurse.
There's also you see a lot of jobs advertised, and we know a number of our graduates looking at some form of clinical education role that requires a DNP, both in an academic setting, so as a clinical educator, say in a school of nursing or health professions, but also clinical education within systems, so within hospital systems and the like.
Okay, will the MSBH FNP DNP track prepare us for both FNP and PMHNP certifications? If not, do you think we will be qualified to work in a mental health facility as an NP or serve in a similar role? And I can read that again because I know that was a mouthful.
It will require you for managing your alphabet well. Please do, Juman. Read that one more time. I want to make sure we're answering it.
Sure. Will the MSBH FNP DNP track prepare us for both FNP and PMHNP certifications? If not, do you think we'll be qualified to work in a mental health facility as an NP or serve in a similar role?
I don't think that the FNP track directly would prepare you to sit for the certification exam for psych mental health.
Right.
I think you could probably get yourself there after the fact, but it would not directly prepare you for that. Is that your understanding, Julie?
Yes, but we do have students that get both, take the courses so they can sit for both exams.
Exactly.
So it's all about preparing you for being able to be certified for the role, right? And it's up to the individuals to take the national certification, which is that's what the preparation is about. So yes, you can be prepared through our programs to sit for both those exams.
It's also, that question aligns nicely with the earlier question about job markets too.
Mm-hmm.
My sense is that the psych mental health arena, both inpatient and outpatient, is an area that's increasingly demanding advanced practice nursing roles, and I think an area of job growth for DNPs.
Oh, huge. And from what we've heard is our graduates from our psych mental health program are, finding jobs very quickly, especially with with the Masters of Behavioral Health. Psych NP combo is and the DNP is just huge as far as being able to find a job. The other combination that we're seeing is very popular and very much being easy. Our graduates are easily finding jobs is the MPH FNP combo. It's been very popular and these students are finding jobs while they're doing their clinical rotations.
And also, one of the reasons I mentioned earlier that we are working on somewhat of a refocus of our program to emphasize more population health, and some of that is in response to the issues of the job market and the demand. And without, we have minutes left, and without getting into the detail, I suspect most of you, if you're in healthcare, know that the change of focus on looking at population health within healthcare organizations is significant. And so we're trying to ensure that our DNP grads come out with the requisite skills and competencies in terms of focusing on populations as well as individuals. And that should enhance the employability for sure.
Okay, I'll go on to the next question. Currently, I am a CNL from Dominican University. I have 450 hours accumulated from 2010 to 2012. Is there an expiration to these hours?
No. Not that I'm aware of for the practicum hours.
Yeah, you noticed us both pause on that for a moment on the expiration. I think not. I think not. That's one that if someone wants to follow that up in some more detail, perhaps that can get forwarded to one of us directly. But to our knowledge, off the top of our head, I'd say no.
No, it's different. I believe it's different than coursework, where there is an expiration if you've taken, a class and it's been like 10 years, because things have changed so dramatically. Hopefully that helps.
Okay, next question. What is your acceptance rate in each DNP program track?
I don't know. Do you know, Julie?
I don't have the exact numbers, but I know there has been a bit more competition in our MP programs for slots than there have been in our DNP completion and our BSN to DNP with the CNL, Healthcare System Leader focus. I can tell you that. But we work very hard that if it's the right person for our program, we do everything possible to make sure we make it happen.
Yeah, that is one. If you really wanted to crunch the percentages on that, we'd have to look at details that we don't have in front of us right at the moment. But I do agree that probably the FNP and Psych Mental Health NP are a bit more competitive programs than the others. But we don't have those details right now.
All right. Does the Executive Leadership DNP program have students from both ambulatory care and inpatient care?
Yes, definitely. From a the ELDNP has folks from many different settings, including we've had folks from entrepreneurial efforts that run their own businesses, that are from academic settings, that are from our CNOs in an inpatient setting to executives in an outpatient setting. Geez, really across the board.
Biotech. We've had people.
Biotech. Thank you. I knew it. Yeah.
Huge. We've had quite a few from biotech because they see the value in the program for them as far as their personal trajectory. And consultants, they see it as having it on their CV is incredibly valuable for them for procuring work. So yes, and it's a wonderful dialogue that occurs at that level.
Do the letters of recommendation come directly from authors? Or can potential students send in sealed letters?
Oh, I don't know how that's done. Do you, Julie? I know what I see is the result of them. I don't know.
Typically what we've seen is that the letters of rec are filled out electronically. So the potential student submits names, and those individuals get emails to complete the letters online. So it's typically done on an online system. The sealed letters, not that I'm aware of, but yes, if you want to know more information about that, you can connect with Carolyn, who's listed on this slide that you see in front of you, and we can get the answers to that.
Yeah,
definitely. It's possible, but it's not the norm.
Yeah, definitely Carolyn or the admissions team are the people to ask that about the mechanics of that.
Next question. I am unclear about the FNP program. Are you an FNP when starting the DNP program?
Well, the answer can be it depends. People who have an FNP, and generally then in that case would probably be masters prepared with an FNP, can enter the program and complete their DNP degree. So that's one option if one is already an FNP. If you are not an FNP, you can follow your education to focus on that so that you're aiming for certification as a family nurse practitioner essentially at the same time that you complete your Doctor of Nursing Practice degree. So the answer depends on where are you starting. If you're starting as an FNP and want that Doctor of Nursing Practice degree, then you can do that. If you're starting out with neither of those and you want the certification as an FNP, you can do that in the context of this, the FNP DNP track. The DNP is a degree. It's a Doctor of Nursing Practice degree. FNP is a certification as a level of certification of
it's a role. Yes.
A role. Thank you. That's what I was looking for. It's a role. The DNP is a degree. I know that can be confusing, but it's sort of, in short, it sort of begins on where are you starting out.
All right, we have time for one last question. I want to thank everyone for their questions, and if you didn't get an answer to your question, please follow up with our graduate enrollment manager after the webinar. So here's the last question. I have an MSHI and would like to pursue a DNP completion and FNP. Would I need to take additional classes?
Additional to what would be my question. That's one, perhaps we want to get that person put in touch with someone to look at more of the details. You would have to complete the courses that are required for the DNP. So I don't understand the question enough to know how to answer that precisely as to additional to what.
Right, I agree. So if you have a master's in informatics, those courses were is part of the School of Nursing and Health. It's the health profession side of our house, so to speak. So we would have to look and work with them. And yeah, as Brian mentioned, you'd have to take the coursework to support the role that you're looking at if you're interested in getting the NP and also the DNP courses, because at the end of the day, those are master's level courses. This is a doctoral program.
For that, the person with that question, I would encourage them to contact Carolyn, whose information's on this slide, and Carolyn will turf that question to the one of us that can deal with it in more detail. But I really encourage you to do that, because that we'd be happy to help you, but we need to probably talk to you to figure that out.
Mm-hmm.
Cool. Juman, thank you so much for your help in moderating this. Thank you for everyone for your participation. In general, that invitation I just made to that individual applies to everybody. If you've got questions, please send them to Carolyn, and Carolyn's really good about sending them out to us and putting potential students in touch with the right faculty member to talk to. So thank you, everybody.
Yes, thank you.
Mm-hmm.